Welcome to the Faith, Health, and Home digital podcast. I am your host, Makeba Giles. Here we share information and resources for physical, emotional, and spiritual well-being to help families live an inspired lifestyle and encourage healthy living. Thank you for joining us. Well, incredible advancements have made in HIV care since the beginning of the epidemic more than 40 years ago. Now, with nearly half of all people living with HIV in the U.S. over the age of 50, HIV research and treatment efforts have shifted to consider how to optimize care for over the long term. Dr. Harmony Garges, Chief Medical Officer at Vive Healthcare, is joining me now to discuss new data from one of the largest HIV medical meetings held earlier this month and key considerations for HIV care as people grow older. Thank you so much for joining me today, Doctor.
Thank you so much for having me.
Tell us, how has the HIV treatment landscape changed since the earliest days of the epidemic?
HIV treatment has changed dramatically since the early days. Remember, in the beginning, we did not have effective therapies for HIV, and many people died of HIV and AIDS. We then developed medications to treat HIV, but they were complicated. People had to take multiple medicines taken multiple times a day on different dosing schedules, and it was very difficult for patients. They'd often have to set alarm clocks to remember when to take which medication. And it required the use of 3 or 4 different medicines to control their HIV. We continued to make treatment advances, so fast forward to today, and we now have a situation where most people living with HIV can be effectively treated with one pill taken one time a day. Now, this one pill does still contain 2 or 3 different medications within it, but nonetheless, it's been a really important advance for people living with HIV.
Yes, absolutely. And I remember those earlier days when there was a slew full of medications, like you said, that HIV patients had to take. So this is definitely forwarding in the right direction. And we appreciate all of the work that you have done too in making those changes for people living with HIV. Now, what are some of the most important takeaways that you would like to share with people coming out of the International AIDS Conference that was attended?
Well, it was an absolutely incredible conference. There's a lot I could say. For now, I want to focus on 2 really important research studies that were done on medicines that we make here at Vive Healthcare. The first one is focused on a medicine known as Dovato. Now, this medicine is one of those single tablet regimens that I mentioned earlier that contains 2 medications. And what we were able to show is that in people, older people living with HIV who took this 2-drug regimen compared to other type of HIV care, they actually had higher rates of treatment satisfaction with the 2-drug regimen. This is really important because it brings sort of that patient perspective, patient voice into the conversation. And it's important for physicians to understand what their patients want in terms of their overall care. The second study is focused on a medicine known as Recobia. This medicine is really important for people who've been living with HIV for a long time, who have multi-drug resistant virus and often limited treatment options. And what we presented at the conference was 5-year data from the clinical trial of this medication that showed even in this patient population of difficult to treat HIV, this medicine was effective through 5 years, continuing to suppress the virus and continuing to increase people's immune cells. So some really important data coming from the conference. Of course, we talked about the safety profile of both of these medications as well. All medicines, as you know, have side effects. And certainly if anyone is experiencing side effects on these medicines, they should talk to their doctor.
Absolutely, and thank you for sharing that information. Now, how could research help address the evolving needs of the community, the research that you're just talking about?
So this research is really important, right? We need to continue to generate data that really builds confidence in some of these recent medicines that are coming forward so that both physicians and patients understand how these medications will work to treat HIV. So if you think about our 2-drug regimen, again, using 2 drugs instead of more medications, it's really important to build that confidence in a 2-drug regimen approach. And certainly for people who have multi-drug resistant virus and limited treatment options, it's important for people to know, even over the long term, that these medications still are effective. So we have to continue to generate data, continue to research, and keep trying to advance HIV care as much as we can.
Yes, we do. Now that many people are living with HIV are growing older, as we mentioned earlier, what are the key treatment considerations in addition to the ones that you mentioned to keep in mind as well?
Well, there's definitely some important considerations for people who are aging with HIV. One of the benefits of these advances in HIV care is now that people who are living with HIV do live long, healthy, productive lives. What that means, though, is some people might be on HIV treatment for decades of their life. So we need to be looking at the medicines that they're taking, doing everything that we can to give them the medicine that they need, but no more, and really try to optimize HIV treatment, taking into consideration, of course, as we age, we sometimes develop other medical conditions, we have to take additional medications. So really looking at how the HIV treatment can work in that environment for the patient to really minimize any type of drug-drug interactions and make sure that their HIV care is optimized and best aligned to their healthy living plan.
Absolutely. Now, speaking of that healthy living plan, tell us where people can go for more information, not just on everything that we've just discussed, but the 2 medications you just talked about that you're developing, as well as additional advancements in HIV care and treatment.
Sure. Well, first, I would encourage people to please speak with their physicians, with their doctors, so that they can understand what options are now available to them, and they can have that conversation about what medicine might be right for their personal situation. If they want to learn more about the 2 medicines that I've mentioned, they can go to our websites. We have Dovato.com, which speaks to the 2-drug tablet regimen that I mentioned, and we also have Recobia.com for those people living with multi-drug resistant HIV. Both of those websites have a wealth of information that will really be beneficial for people who want to learn more.
Thank you for sharing that, because that's what's needed more than ever now. It's more information, the most updated information and resources for people living with HIV, especially for long intervals. And again, those websites are Dovato.com and Recobia.com. Definitely go there for more information and keep yourself up to date with the latest advancements, and definitely talk to your healthcare provider to find out the best treatment plan for you for the long term. I want to thank you so much for joining me today, Doctor. Thank you for sharing everything with us today. It's been a pleasure. And thank you for all that you're doing for the HIV community.
Thank you so much for having me.